Hello, everyone, and thank you for joining us today for Healthy Roster's overview of our Safer Campus. We have a couple different titles for the product based upon who we're talking to. So if you saw Safer Play, or if you saw Safer Workplace, or you see Safer Campus, you're in the right place. Our Safer Surveys platform is a COVID-19 symptom tracking and alert platform and can be used for a lot of different types of people, whether it's workforces, staff, faculty, students, or athletes, or really anyone who you can put into the system and send a daily screening and survey to. So I'll tell you more about that in a little bit. A couple admin notes. We've got a lot of people on here today, so I'm going to go ahead and keep everybody on mute, but I would love to see your questions and hear feedback. So if you look at the bottom of your webinar portal, there's a Q&A widget or button. If you click that, you can then put your questions in anytime throughout the presentation, and I will get to all the answers here at the end. So I want to start with a little bit of background on Healthy Roster. So we're a 5-year-old company. We started out building communication software and telehealth software for sports medicine professionals at the high school, college, and professional levels. We've partnered with over 200 major hospitals and health systems across the U.S., and we're built on the Amazon Healthcare Cloud. So we are fully HIPAA compliant and secure. Today, our telehealth and EMR platforms have logged well over 1 million treatments. And last year, our customers asked us to build a survey and alert tool to actually help with supporting the mental health of specifically athletes, and much more common at the college level, but also common, unfortunately, these days at multiple levels from high school to pro. And so what we did was we built a survey and a screening platform that I won't really get in today, but it can deliver depression screening, substance abuse screening, really any type of measurable survey across your organization that you'd want to deploy. But today, I'm not going to focus on the specifics of that. I just wanted to reference that because that is what's allowed us to move so fast in developing the COVID-19 symptom tracking and alert platform that you see in front of us. So this isn't brand new technology that we're trying out just for COVID. It's just a new screening as part of our Safer Survey platform that's been in the use in the market for well over a year, giving out these depression, these substance abuse, the eating disorder, and sleeping surveys as well. So as we start to focus on the topic today, which is how do we return to campus? How do we return to play? How do I get our staff back to campus to figure out how we adjust to the new normal? We're excited to help you with your need to guide, structure, and support your staff, your faculty, your students, your athletes, as you get that plan in order and get everyone back on campus. So again, I'll use the word athlete. I may use the word staff or faculty, but again, anyone who you need to use or who needs to be part of your COVID symptom tracking and screening platform or program can be used in the system. So I want to start by jumping in on the acronym. So Safer, you see that capitalized. That stands for the icons along the kind of middle bottom of the screen. Screen, alert, facilitate, engage, and report. So I will go through those steps in today's presentation, and it's not going to be very complicated because people don't use systems that are hard to figure out or cumbersome or take time. And so we made it very easy for both your administrators and your users to take the daily symptom tracking screening. And so let's jump in and set a little context. So I don't think this is news to anybody. If you're on the webinar today, you're probably here because of this slide, right? So whether it's federal government or state government mandates, everyone's pretty much saying that you've got to do something to ensure that you understand who might have symptoms, and you need to keep them away and keep them at home so that they don't make other people sick. So even while the actual laws and the mandates can largely vary from location to location, there's commonality in that it's common sense, right? These are the two big things that everyone needs to try to work together with our government and our healthcare agencies to make sure that we can do everything we can to keep people healthy. So The rest of this will really probably come down to your organization's policy and the types of programs that you decide on how to define, comply, and monitor. But we want to support you with kind of the basics that will be universal across every single program. So we're going to help you find those that don't feel good and make them think about it before they come to school or work or whatever kind of organization you are. And then keep them away from others by alerting the administrators, alerting the person, and making sure that they understand, here's what we need you to do next. So there are organizations that set out, we started talking to a couple months ago that said maybe, we'll do this on a spreadsheet, or we'll do this via email, or, maybe we'll take temperatures at the door every day. And while each one of those things is a piece or a part of the process, couple problems. One, we're getting pretty close to the return to campus and return to play timelines. And so these policies and protocols can be cumbersome, they can be costly, and they can take time to establish them. And most importantly, educate everyone in the organization about what those new things are. And so at the end of the day, the actions that need to be taken and effectively deployed are provide a symptom assessment, track the results, alert administrators, create actions to ensure that the athlete, the staff member, the faculty member, the worker stays at home, and then have the ability to connect them with your healthcare clinic, with a healthcare provider, with an occupational health provider. And so using manual email and phone processes are just not going to give you all of those 4 key actions. So today I'll show you here real quick, again, pretty simply, how Safer Campus does this for you. So like I said, it's pretty easy. We're going to walk through how the survey is sent out via text. We're going to show you how the responses are logged in Healthy Roster, how the protocols are delivered to your administrators so they don't have to remember what the steps are to follow when they get critical responses, show you how the telehealth engagement of a healthcare partner works, and then show you some of the reports and talk through how you can see trend indications by team or department or location or facility. So I'm going to not read the bullets to you because it's not that complicated. I'm going to show you, I'm going to talk you through moment by moment, kind of the day in the life of delivering the screening program for your organization. So on the left-hand side there, you see just a basic text message in an iPhone frame. And so you can customize this message. You can customize most of the interactions and the communications that you see today. If you don't customize anything, and I'll get to kind of the price program at the end, there's no setup fee. You could roll this out very quickly. You could CSV upload your entire organization. You could structure them into different departments or different groupings. And then you could schedule this to go out every day at 9 a.m. It can get a lot more complex in scheduling if you have staffs or time zones or intermittent events. We can handle all of that for you. But I'm going to show you kind of the simple path here today. And then we'd be happy to take questions about how to handle specifics to your organization. But this text message goes out, says, please complete your COVID-19 symptom screening prior to coming in today. And you click that link. The user, the student, faculty, staff member, does not need to download anything, does not need to sign in with a login or a password to anything. This link is individualized to the person who's received it based upon your upload of those people and their cell phone numbers into our system. So when they click on this, they actually go to a secure web browser page, and it simply asks them these questions. Have you had a temp of 100.4? Yes or no? Those are the organizations that are asking people to take their temperatures at home. If you're not asking people to do that, we have a version of this that only asks you, do you feel, are you currently caring for someone who is? A yes on either one of those answers will then generate question 2 through 5, where we follow the CDC federal guidelines for what the COVID-19 screening assessment is today. And it's constantly changing, and we're updating it as the CDC adds or changes different symptoms and becomes aware of different indicators of what symptomatic looks like for this pandemic. So here I'd fill out my survey, and when I complete it, I get a thanks for filling it out. And that's it from the end user perspective. The next step is the administrator view. So this is now an administrator who does have a downloaded Healthy Roster app on their phone, does have a password and a login, because there's some things you'll see that they've got to do specifically. But this is just people who are designated as administrators of your program for each group or for the entire organization. They're going to get notifications. They're going to get a push alert on their phone. If they're sitting on the web browser version, they'd also see the critical alerts come through on there as well. So I'm just showing you the mobile version today. And there you see Judy Mitchell's at the top. So I've got a critical alert. When I, as the administrator, click into Judy Mitchell's critical alert, I'm now in the alert. And so we scrolled down the page a little bit, but you'd see her name at the top. You'd see a link to the survey results in a PDF format so that you could forward that to a medical professional or review it for if the administrator of this organization is trained to assess the symptoms. Here you see what this standard protocol looks like is, hey, first thing is reach out, contact the athlete. So this is the athlete scenario, right? So you don't have to look up the phone number, don't have to look up the email. You can just hit the call button and it would connect you with Judy. So hi, Judy, this is Jason. I just got your screening results for today, and it looks like you feel ill and you've got some of these symptoms here. Are you okay? Where are you? And please remember, our policy is that you please stay home. And the next thing I'm going to do is alert the administrators of our organization so everyone knows that we've got a symptomatic person. And then the next thing I'd like to do is connect you to our health clinic. Let's say that that's the protocol for the organization, the imaginary organization that I'm talking through, right? So the next step would be connecting via telehealth call directly with a physician or a nurse or someone that you've designated as the first point of contact to more medically or clinically assess and advise them on how they're feeling, where they've been, what they're doing, and they would enact the medical procedures in reaction to that, and maybe guide them to get testing in a facility where they weren't going to expose themselves to anyone else. So this prevents the people in your organization from walking into a clinic, potentially coughing or sneezing or doing whatever before they get to someone and say, hey, I may be symptomatic, and exposing other people. This kind of keeps them at home and reduces the risk across your organization. So that's it. Those are the steps that I wanted to walk through in terms of the screen, the alert, the facilitate, and the engage. The last step in SAFER is the R, which is reporting. So there's a number of different reports, but this one right here is a pretty functional report. It's the screening report. And what you see there is the roster of people that have been screened today. Down the middle, if your screen's large enough, you see a completed date in orange, and you see 2 not completed. So there's a couple different ways that you could use this report. In a scenario where you have controlled access to the facility, you could make sure that managers understand that their team on shift coming in, let's say it's campus security or campus maintenance or a department head or a classroom professor or a coach or an athletic trainer. All these different scenarios, these are the different types of administrators I'm kind of rattling off, could use this almost as a roster or a checklist. And so if Dennis shows up at practice, I can say, hey, Dennis, I didn't get a survey from you today. And he said, I didn't get one. I've had my phone with me. And you say, is your phone number? And look to the right there. Is your phone number 614-981-1648? Oh, no, it's 1649. Okay. I could click the profile there. I could change the cell phone number and I could resend the survey and say, hey, please step back outside and take the screening, because part of this for my organization is standardizing that everybody knows how to do this and that we have a log and a compliance and a report to say, look how hard we're trying to keep our organization safe. And so that would be the protocol in this example. So the last thing that I want to end on is what the end user saw. So we started with the first 2 slides where they got the text message, they clicked on it, they took the survey, and now what happens is they get a response. So if you kind of look at that left screen behind the green one on the left, you see you've been cleared, click on this verification link. What we've heard from a lot of organizations is that I don't want my screening personnel or the people accessing or controlling access to my facilities to have to get so close to them that they've got to read the date, the time, and the text message format. And so we can pop a green or a red screen with big key visuals. There's QR codes, so you can go right into this person's profile, so that if you wanted to do a temperature check at the door as well, the person at the door would have the Healthy Roster app. They'd scan that QR code, up would pop Judy's profile, and they could put in the temperature as well. So two-step verification and logging every single time that there's access to the facility. And then next time if Judy had to leave the building and come back, you'd see, hey, Judy was cleared today, and I already have the temperature. We have a scrolling Healthy Roster logo at the bottom, so you can see it's live, so people aren't sharing screenshots with one another. But at the end of the day, I always get the question, how do you enforce honesty? And I wish I had a good answer to that, because you can't make someone be honest. But from a legal perspective, what we're recommending our customers do is go to their legal teams and craft an affidavit, which we could actually deliver as a survey and say, here's our new policy for the 2021 school year for all faculty, staff, students, and athletes. Here is what you must understand. And then they could put in their initials after each block of text, so that you have a saved copy of the affidavit that was delivered to them. It was a unique code for them. They filled it out, and it stores it right to their profile inside a Healthy Roster as well. So that's it. Again, I said it was going to be pretty simple and pretty straightforward, because it's got to be easy to use so that everyone uses it every day. And the key to this going out every day and being easy is that after a few weeks of being back to campus, it's just human nature to forget to think about and keep this top of mind every day before you leave your house. Man, I just have a cold, I'm fine. But when the symptom checker pops up and it's required to get admitted, then it makes you stop and think about the symptoms that you actually have, and then you can talk through it. And so it's a daily reminder. It tracks and records and reports, so your organization can also identify trends. So as we've all seen in the news in the past week, teams are starting to see, 2 players, then 20 players. And so if you see that pop in that trend, and testing is very expensive. And so some organizations are doing it every 5 to 7 days, which misses a lot of opportunity to ask somebody how they feel before they actually show a fever or present as physically symptomatic to other people who can notice it. This is a way to go out every single day at a certain time before people come into your facilities and potentially expose other people. So if you'd like to learn more about Safer Campus or Safer Play or Safer Workplace, take a look at healthyroster.com, and on our main page of our website, you'll see 2 big blocks that ask you kind of who you are. Are you an employer with a workforce, or are you a college or higher level educational institution? And so you can learn more there, see a little bit more information, and then talk to our product experts that can talk you through specifically what your needs are for how many people, and whether or not you need any customizations. And so the price is a per person, per month price. And that price is dictated by the size of your organization. So the larger organizations scale down the pricing, but there is a hard cost for the text messages to go out every day. We do have an email option that we can provide you to reduce the cost, but it also kind of increases the complexity of taking the survey, because now everyone must get into their email and take the survey from that way versus that text message kind of popping out in front of them. So there are some minimums required, and we can talk that through with you and your organization. And again, one more time, customizations to anything that I showed today require additional setup fees, not exorbitant, but we do have to do some manual custom development work. And sometimes the customizations requested are quite extensive, and we can support those. We can customize just about anything that you saw today for your organization with your own words. So I'm starting to get a bunch of questions in here. Let me pivot for a moment and just get into reading these. Not everyone is going to be on campus every day. How does this help manage flow, and how does it help with mandatory reporting? So Through a number of conversations we've had with organizations, part of that policy memorandum that you publish can be, you don't have to take this every day if you are not leaving your home and coming into a public space. And so if you use this as a way to kind of track admittance or access to facilities, this is their key card or their pass. So everyone knows if I'm going in today, I have to take this. If not, I just ignore it. And it's just one text. It's not going to bug you all day long to take it. There's no timer. There's no reminder. So it's simply, you're going to get this text from this organization. You're going to get it at 9 a.m. Hey, night shift, you're going to get it at 4 p.m. And take it every day because we're not letting you in without seeing the green pass. Let's see, next question here. So this is about languages. So can the screening be translated into different languages for international students who may speak English but not be particularly comfortable reading it? Yes, so that would just be a customization. So we'd have to understand which languages, how many different languages would you need, but we could get that translated for you as well. We do have a language service provider that helps us, so they put it into the right questions in the right framework. Is it possible to do a mix of text and email? Most internationals don't have a working US phone number. Yes, so that's actually one of the reasons that we created the email option from the get-go was we heard that the internationals largely still have international phone numbers, and so the text messaging costs can be quite high or just too complex to deliver something like this. So yes, you can decide and kind of toggle, if you will, which organizations or which students or staff members specifically get which version and which screening. So that's all part of setup. So you could create, let's say the other language is Spanish. You could create a Spanish organization, toggle that organization on, and all of those individuals would get only that screening on a daily basis. What if we don't have all the cell phone numbers? So if you want your policy and your program, and you can appreciate why text messaging is an effective thing out there in the market today, and why it's probably more effective than email, part of the kind of new era would be creating a mechanism for you to get updated cell phone numbers from everyone in your organization. And then when you send out, if let's say the affidavit or the first day of your survey, you would see who's not filling it out, and you could then follow up individually with those departments and those managers and say, hey, I need you to go into a Healthy Roster and update this. For whatever reason, the cell phone number provided failed and we haven't had a response. You could probably even do a couple test runs, 2 or 3 days of testing, before the program officially kicks off to do something like that with the screening that you saw today. And say, hey, I want everyone to start to get in the habit of taking this 3 or 4 days before you come back to campus, because day one will be this date, and you won't be allowed in any facilities if we can't validate that you passed the screening test today. So another question kind of around smartphones. So yeah, we know that typically 80 to 85% of the population today has a smartphone, but that's not everyone. So for those people, they would use the email option. And that's where it gets a little cumbersome. If they don't have a smartphone, then they've got to log on to a computer, log into their email and take the assessment. But those are the decisions that are up to your organization about how strict you're going to be with these new policies and procedures. But we kind of live in an era where that might be required. What's the onboarding process look like, and how long does it take? So it's a pretty easy upload process. We do have a mass CSV upload. So whether you have 100 people or 10,000 people, we can pull all those into Healthy Roster in a mass upload. And then we start to work through what we call organizations. So well, like if you caught the example earlier, my campus security staff might have two 12-hour shifts, an AM and a PM. And so I could upload the AM guys, associate them into a organization, and I could schedule their automated screening to go out at, let's call it 6 a.m. because they report at 7. And then I could do one for the PM, and I could set them to 6 p.m. and they'd report at 7 p.m. So, and then think about teams and departments and facilities. It's just about thinking about how to organize your populations so that they get the survey at the right time every day. And for those that you don't know that aren't standardized, it's, hey, I'm going to send it out at 8 a.m. And so before you come in, it doesn't matter whether you take it at 8 a.m. or you take it at 4 p.m. You just know that you have to complete this so that we can track that you've completed it before you enter our facilities. So what other reports? So the report I showed you was kind of that roster report and reviewing kind of in a moment in time who's taking it, being able to resend it, being able to view the results. We do have some trend analysis as well. So you could look by organization over time as well. So this is where the trending starts to come in. And so if you start to see an early trend, maybe some of your senior administrators want updated, 12-hour reporting from your organization or the sub-organizations when you start to see a spike in trend and you shut down activities or facilities that have started to show a positive trend before it becomes a major outbreak. And that's another thing that kind of a manual email and phone process just can't handle very well. All right, so looks like that's all the questions today. I saw some duplicates in there, but I hope I answered your question. If I didn't, again, please go to healthyroster.com, click on those blocks on the front page to get into the right segment that kind of speaks to you and the type of population you're trying to serve. There are chatbots on the website that connect you. They'll ask you a couple questions from an automated perspective and then connect you to human. So we can understand better how to solve the programs that you're looking to solve and give you some advice too. A lot of the people that have come in and said, we're thinking about this, or we have a task force, or we have a project committee, and gosh, there's so many options. We've talked to probably 300 organizations in the last 6 weeks, at least 300, probably way more than that. And some very large, very big professional brands, conference level commissioners who are all, everyone who's an administrator here at the college function is really knowledgeable about their organization. But this is something new to all of us. And so there's a lot of different things to consider and a lot of different directions that you feel you can go. So we can kind of help you walk through the pros and cons and those different conversations that we've had as well. So we look forward to talking to you soon at healthyroster.com. And thanks for joining us today. All right, everyone, please stay healthy and take care.